Okay, now that we've did your health history, now I'm going to do the physical assessment portion of your exam. First, I want to start by saying that this is patient confidentiality. This video is only used for my teachers to grade me. It will not be shown to anybody else. You have the right to decline this, and you also have the right to, at any point during the exam, you feel uncomfortable or don't want to do a certain portion, just let me know and we can skip that portion. All right, so starting off, we'll start from head to toe. This will consist of me touching, palpating, and asking you to do certain cues. With your face, the skin looks normal, no lesions, no scarring. When I feel of your head and scalp, I don't feel any bumps, abnormal knots, or lesions. Feeling your temporal arteries right here, okay? And then the other side. All right, if you'll open and shut your mouth a couple times. Okay, no clicking or anything like that. Now open your mouth for me, don't let me shut it. Okay, now if you will, I'm gonna grab a cotton ball. If you'll close your eyes and tell me when you feel this. Yep.
Okay.
Okay. All right. Now, if you will, this is the first nerve we did with the clenching your teeth. That's cranial nerve number 5. Now we're going to check cranial nerve number 7. If you will close your eyes tight, raise your eyebrows, up and down, good. And if you'll smile, frown, puff your cheeks out. Very good. Okay, I know that's weird. So now we're going to go to the eyes portion. Optic nerve number 2 is checking your acuity, your visual acuity. Approximately 20 feet away is the Snellen chart. Can you read line number 6 for me?
E, D, F, C, D, E.
Okay, if you'll go up to line 5.
F, D, C, F, S.
Okay. And if you'll read number 4 backwards to me.
D, E, F, L.
Okay. All right. So she is aware she does have vision problems. As of right now, you don't wear contacts or glasses or anything though, but it wouldn't hurt you to go to the eye doctor and get some. Okay, right now I'm going to get my pen light and I'm going to check your eyes going in different directions. I want you to keep your head still and follow my pen for me, please. All right, good. Now I'm going to shine a light in your eyes. If you'll just remain looking at my nose while I do this, is checking your pupils to see if they're reactive to light. It looks like you have uneven pupils, but a doctor has addressed that. They do react to light though. The sclera is normal, white, and then the conjunctiva is pink and moist. Iris is green, and it doesn't look like anything, no lesions or anything abnormal going on with your eyelids. Your lashes and your eyebrows are healthy and even. So moving on to the ears, what I'm going to do is I'm going to hold this ear and whisper on this side and the same on the other side, and I just need you to repeat to me what you hear, okay?
Watermelon. Hot dog.
Okay, I know that's random. Do you have any problems with your ears at all? Okay, looking at them, I don't see any lesions. It doesn't hurt for me to touch or anything like this. Okay, awesome. So now I'm going to look at your nose, get my pen light back. If you'll tilt your head back, I'll look in here. I don't see any occlusions, no deviated septum. The mucous membranes are pink and moist. If you will, I'm going to hold one side of your nose and I want you to breathe in and out, and I'm going to do the other side as well. Okay. So that is patent on both sides, no occlusions. I know you do have sinus problems. I'm going to palpate your sinuses and you let me know if you feel any tenderness. Okay, got the maxillary facial, frontal I mean. At this point, we're going to look at your inside of your mouth and throat, and I'll use my tongue blade to push your tongue down so that I can see your uvula, and we'll check your gag reflex as well. So, open your mouth for me. Okay, uvula is midline, roof of the mouth. Okay, roof of the mouth is pink, and mucous membranes are moist and pink. I'm going to check your gag reflex now if you'll open your mouth. Okay, all right. So if you will, open wide and say ah. Okay, and then stick out your tongue for me. All right, that's cranial nerve number 12. Saying ah, I'm checking gag reflexes, cranial nerve number 9 and 10. Moving on to your neck, I'm going to check your lymph nodes starting in front of your ears, back, down your neck, and the back, and your cervical. So we've got the pre-auricle, and behind the ears is the post-auricle, and then you have the occipital behind the head here, and then we have going down the neck the post-cervical, and in the front here we have the submental and the submandibular up under here into the chin, and then when we go down we have the subclavicular here. And I do not feel any swollen or abnormal lymph nodes. Now, if you will, I'm going to ask you to turn your ear to try to touch your neck on this side, and to the other side, and back, and front. And when you shrug your shoulders, I'm going to push. Okay, resistance is good. At this point, I'm going to palpate your carotid arteries. This side. Okay, and now on this side. Okay, great. And now I need to listen to him, so I'm going to get my stethoscope. I can't believe I left it in here. This is an actual simulation where I leave my stethoscope laying everywhere and have to run out of the room to look for it. I'm going to listen to your carotids here. Okay, and the other side. Alright, I didn't hear any roots, so that's good. This part of the exam, I'm going to have you sit on my stool and face that way so I can see your back. Okay, if you'll turn more this way for me. Okay. So now we're going to check the posterior side, and first I want to just inspect and palpate the back. I'm going to raise your shirt here. Alright. I don't see any abnormalities. If you'll take a breath for me. Rise and fall, look even. Now I'm going to palpate the tactile fremitus, and this is looking for any type of vibrations, seeing if you're not congested or anything right now, are you? Okay, so I'm going to put my hands here. If you'll say 99.
99.
Okay, again.
99. 99. 99.
Great. Everything was even, and now I'm going to percuss What I'm going to do is I'm going to put my hand and then I'm going to hit my hammer on top of my hand just to check. Okay, now I'm going to listen to your lung sounds. Deep breath. Alright, great. I did not hear any type of congestion, wheezing, any type of abnormal sounds. Now I'm going to check and see if you have any tenderness in your flank. I will take my fist and lightly tap both sides. If anything is tender or hurting you, let me know. Okay. You can sit back on the makeshift table now. Pardon me. Okay. So now we're going to check your arms, your upper extremities, palpating and looking at the arms. I don't feel any knots or lumps on the arms. We do have a couple scabs from bug bites. Looking at the hands, she does have arthritis. Multiple joints are swollen in the distal and top portion of her fingers, digits, turning over her wrist. Very kind of swollen and tight as well. She does have a history of arthritis. At this point, I would ask you if you could lift your arms above your head. Okay. And now if you can lean forward and try to lift behind your back. All right. And now up and down. Okay, now I'm going to check your wrist. If you'll just stick your arms out for me. Bend your wrists down and flex them up. Same with your fingers, up, down. Okay, so grab my hand, squeeze, equal on both sides. I'm going to push you, try to do resistance. Okay, I'm going to pull you and you pull backwards. Resistance, okay, push-pulls are even bilaterally. Grip strengths even bilaterally. I'm going to check your capillary refill. With both hands, less than 2 seconds. I'm going to check your radial pulses on both arms. And then your brachial. Okay, this arm as well. Alright, now I'm going to check your reflexes on your upper extremities. So what I'm going to do is I'm going to have you just relax your arm for me, and I'm going to tap the back of your arm here to check your tricep reflex. There we go. You'll roll your arm over like this and just relax it. There we go. And then I'm going to go right here. And then the finger and the thumb rose up. Same on this side. Relax your arm. Okay. Okay. And forward. All right. That's good. So checking the rest of your range of motion. I need you to bend your elbows up like that. Arms flip over. Okay. Looks good. Now I'm going to trace, I'm gonna have you close your eyes and we'll trace a number on your hand and you tell me what number.
3, 4,
Keep your eyes closed. I'm gonna place an object in your hand and you tell me what it is.
coin,
Okay. You can open your eyes now. Now we're going to have you lay down. You'll slip your shoes off. Looking at the chest with the breathing patterns is even rise and fall. palpating here. No abnormal lumps. The chest. When feeling of the PMI, it's normal. I don't feel any heaves or thrills or any struggle to breathe when lying flat. At this point, I'm going to listen to your heart sounds, and there's, I think, 5 different places I'm going to listen to. Alright, so on the right side over here, this is the aortic. Okay. Pulmonic. I'm going to slip this under your shirt. Here we have the herbs. And then tricuspid. And then moving over to the left some, we have the mitral. Okay? S1 and S2 is normal. I do not hear a murmur, any extra heartbeats. You don't have a history of any heart problems, murmurs, or anything like that, correct?
I don't know.
Okay. Alright, so now we're going to move on to your stomach. I will raise your shirt just a little bit. Are you comfortable with showing some skin?
I'm fine.
Okay. And I need to see your belly button, so if you'll pull your waistband down. Okay. So looking at all 4 quadrants, I do note that she has a scab from a bug bite on her left side over here. When assessing the abdomen, we must inspect, auscultate, percuss, and then palpate. So she doesn't have any type of umbilical hernia. There's no history of inguinal hernias or any other hernias that she has. Starting with auscultating, we'll start here. I hear bowel sounds there. There. And there. Alright. All 4 quadrants have bowel sounds that are normal. She does have a history of IBS, so I expected to hear bowel sounds quickly in all 4 quadrants. So at this point, I'm going to also listen to your renal arteries and then your aortic. I do not see any type of pulsation in the abdomen with lying flat. My Lippmann stethoscope does not have a bell. It is some type of cardiac stethoscope that has, I guess, both of them built in. So listening over here for the renal artery. Listen over here. Alright. And then that aorta is up above my belly button. Alright. So now I'm going to get my reflex hammer and I'm going to percuss in 4 quadrants. A dull sound signifies that I'm over an area that has air, and then the resonant signs, and then the dull signs is that I'm over the internal organs. So here. Okay. Now I'm going to palpate. I'm going to start lightly pressing, and then I'll get a little bit deeper after that, and you tell me if you have any discomfort while I do that. Go a little bit harder this time. As I go over the right upper quadrant, I'm able to feel a little bit of the liver here. And she still has her appendix, but her gallbladder has been removed, so you can fix your clothes there. All right, now I'm going to look at your lower part of your body with your legs. Looking at the skin, we have a normal color. There's no signs of cellulitis or any signs of poor peripheral vascular problems. Going to feel for the back of your legs is going to be feeling for your popliteal pulse, and then I'll feel your posterior tibial and then your dorsalis pedis. So starting here. Okay, there's that one. Alright, so now going to the inside of the ankle, I'm going to feel with the dorsalis, the posterior tibial here, and on this side. And then you can just raise your socks up high enough for me to get the dorsalis pedis up here. We do need to know that there is some swelling. She has on both lower extremities. She's had surgery to fix an ankle fracture from 2009, and then there's also some swelling, which is less on the right side than the left. The pulses are present though, diminished a little bit more on the left than the right. Okay, so at this point, if you can lift one of your legs for me. All right, don't let me push it down. All right, try this one again. All right, now if you'll try to lift your knees to your chest, please. All right, and with your knees, try to turn them inward. Try to turn your, okay, turn them inward. There we go. And ankles, if you'll flex them up and down for me. All right, let's push against my hand here. All right, push here. Very good. Now if you'll sit up for me, please. I'm gonna check your reflexes. All right, something I forgot to do when we were checking your upper extremities. If you can, close your eyes, hold your arms out, touch your nose with alternating fingers. Close your eyes for me. There you go. A little faster if you can. All right, very good. Now we'll get your reflexes here. So the tendon right here too. Are your feet hanging? They don't have to touch the floor.
Okay.
Sit, like bring your, there you go. So your legs are hanging. There we go. Wait a minute. About keep me all there. There we go. All right. So now I'm going to check your Achilles tendon reflex back here. All right, on this side. Very good. If you will, take your heel and slide it up and down your shin on the other side as well. Something I forgot to do when we were laying down. If you'll lay back down, I got to check your Babinski. So I'm going to take the bottom part of my hammer here, and I'm going to run it up the foot. Okay, relax this foot. I'm going to do it on this side too. All right, there we go. All right, you can sit back up. All right. If you'll stand up for me. Can you walk on your heels? All right, back up. And now on your tippy toes. Okay. And if you'll close your eyes for me and try to stand as still as possible. Okay, great. Can you hop on one leg for me? Okay, and the other one is the ankle she hurt, so we're not as good as that on that side. All right, now I'd like you to bend over for me. I'm going to look at your spine. Okay, looks normal. Now if you'll try to bend backwards for me. All right, and side to side, please. All right, that will be the end of the physical exam. You may sit down. Now I would like to go into the teaching portion. So you have a very prevalent history with blood pressure, high blood pressure in your family. I've created a handout here that I want to give you, and gonna teach you about the effects of hypertension if not controlled. So we'll just start from head to toe. Hypertension uncontrolled can cause stroke, vision problems, heart failure, heart attack, kidney failure. A lot of different organs are affected by your blood pressure. Something to watch for in your diet would be keeping the sodium under control. And a lot of people don't understand that just because you don't pour salt in there doesn't mean that it doesn't have sodium in it. So we need to look at the back of the nutrition facts on the back of everything we eat. Soda pops are high in sodium, packaged food, things like that. Just look at the sodium content and try to keep the sodium at a low. Trying to think of any other tips that I can give you before I give you this handout. Exercising, trying to get some walking in more days out of the week than not, and at least 30 minutes at a time. When you run after Micah, that's good enough.
Yeah.
And then so diet, exercise, and just being mindful and monitoring your blood pressure. You have a cuff at home that you can monitor it with. Some signs that your blood pressure may be up is having headache, your vision being disturbed, things of that nature. If this goes on for a long period of time, you need to contact your doctor and see if there's anything you need to be put on medicine or anything. The American Heart Association has recently lowered the threshold for hypertension. It used to be 140/90. If it's above that, you're considered having hypertension. But now if it's above 130/80, that is the new guidelines for diagnosing hypertension. So we need to be mindful of that when you're checking. And if you do start getting high readings, keep a log of it, so when you do call your doctor, you can let him know when it started and how long it stayed up. But kind of be mindful of what you're eating as well, so you can know that when the doctor calls. Any other questions about blood pressure?
No.
Okay, that's the end.